and see if we can find that during the testing.
That makes sense.
All right. Are you ready? Good. We'll go in the other room and do the procedure then. All right. Depends on what kind of procedures we can do to help you the best with that.
When do I talk to my doctor about the results?
As soon as we're done with the testing, I'll take you back into the room and let you get dressed, and then you'll be meeting with the doctor and coming up with the best plan for you.
All right. Thank you.
You're very welcome.
I'm ready.
All right. So the next part of the procedure, we're going to be moving over to this other chair. So what I'm going to have you do is sit on there and have your calves up in these stirrups. So you might want to keep that nice and loose. Good. All right. So the very next thing I'm going to be doing is inserting a catheter into your bladder to see how well you emptied when you were over there.
Is it going to hurt?
It's going to feel strange, but it shouldn't really hurt.
Can you show me what the catheters look like?
I'd be happy to. It's this flexible catheter. You can see it nice and movable. And I'll be putting a lubricant on the tip so it won't be dry.
That's pretty tiny too. All right.
I'm going to be bringing the table up. I'm going to zero their pressures. This is the bladder catheter. There's a microchip, a tiny one right here, that we can measure the pressure in the urethra at the same time as the little sensor down here that will measure the bladder pressure. There's one on the tip of this one that goes into the vagina. Where those are on the catheter, they're a little stiffer, so you may notice kind of a different feeling as those are passing through.
Okay.
Okay, I'm going to be inserting now. The next step is now I'm going to put these little sticky pads down on your bottom to see if you squeeze your butt muscles to hold in urine.
And why is that important information?
Well, if you're doing that, we can see it on the monitor and we know if you're able to hold it or not when you're squeezing.
Does my butt need to be working in order for me to be able to be effectively controlling my leaking?
Right, well, some people can do that and some people can't.
All right.
And so if you do leak and you're trying to hold it, we can see if you're actively using those muscles. Some people's muscles don't work very well.
All right. Are those electrodes or are they just sensor?
All necessary, however. Good. We're ready to go. So now I'm going to start backfilling the bladder.
So it's just going to feel like you're putting water back inside me?
Yes.
Okay.
But I did warm it up to body temperature, so it's not going to be icy cold.
No. How much water are you going to put that whole bag back inside me?
No, that's going to kind of depend on you. Next thing I'm going to have you do is cough. Big coughs. Bigger cough. And again. Good. All right. You're still dry. Excellent. All right, so I'm going to be filling you some more. All right. Good. So we've put some more fluid in, and I'm going to have you do that bearing down again. And push, 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 push. Good, and I got that leak. Excellent. All right, now I'm going to start filling you again until you feel like you're full. Your bladder's full now. Things. And are you comfortable?
Yes.
All right, you're done? All right. Well, this looks normal. As you can see, this top line, that's the catheter in your bladder. This red line is the catheter that's in your vagina. This green line is a subtracted one of those, so I'll be able to look back and see, which I didn't during the procedure see anything unusual. It would tell me if your bladder muscle is contracting when you don't want it to.
And that's the blue line on top.
That would
Or
be
the
the green
green
line.
line. All
Yep.
right.
This is bladder, vagina, and this is a subtracted. This line here are those sticky pads down on your bottom. This red line is when you were urinating. It tells me how the flow was going. And then this green line down the bottom tells me the volume that you went. And I can see that you emptied completely. And I'll be able to look at the rest of the pressure readings after I do a printout, after I unhook you.
Some of these little peaks and valleys, what does that tell you?
What this is telling me is you were bearing down, and this spikier one here is a cough.
Got you.
So bearing downs and coughs. So far looks fine. I did notice back earlier on when you did leak, it was at a higher pressure, so up towards the top here, and that tells me that you have stress incontinence. And so I'll be able to pass that on to the physician, and they'll be able to help you out.
Okay.
Any questions?
Nope, not right now.
All right,